The bottom line is patients should never be abused.
Mountain Home VA's new director answers our questions about patient abuse just months after a community watchdog investigation raised questions about cases in the past. Thanks so much for choosing News Channel 11 at 6. I'm Josh Smith.
And I'm Sarah Diamond. Mountain Home VA employees did not abuse any patients last year, according to the medical center.
Yeah, and that is an improvement. Our year-long community watchdog investigation previously found 3 abuse cases in 2015, and all of those employees kept their jobs. In an update, Nate Morabito asked the new VA director what he's going to do to make sure patients are kept safe and employees are properly disciplined.
It's horrible. I think that's terrible.
This is how veterans reacted when we told them what we uncovered in Mountain Home VA.
Well, I was horrified.
3 different employees suspended for a handful of days for abusing 3 different patients in 2015. Records show one refused to give a veteran water, another mocked a man and left him on the toilet, and a third took a veteran's food away before he was finished eating, then later talked down to him when the veteran threw a coffee cup in his direction. Congressman Phil Rowe shared similar outrage.
And they just need to work for somebody else. They don't need to be serving veterans.
All of this occurred long before new VA Director Dean Borses took over earlier this month. He says the disciplinary process is now improved.
The staff has done a lot of good research, taken a lot of good actions, put process improvements in place for both that and a variety of other things.
Borses says one of his priorities is giving employees the education and training they need to prevent abuse and other issues that impact veterans' health, safety, and welfare.
If we have staff members who deviate from that, then we will address it appropriately.
But what does appropriately mean? Some have questioned the past definition.
The VA needs to be more accountable and they need to be more responsive, and some of it's not their fault.
The agency is bound by federal guidelines but has some freedom when it comes to the range of punishment. In the 3 previous cases, the employees were all first-time offenders. Mountain Home gave them all a shot at rehabilitation.
Well, a staff member should never do anything that would abuse or hurt a patient. We also have to make sure we follow the right processes and procedures to train, educate, and rehabilitate folks so that everybody has the opportunity to do better.
Borses, a veteran himself, says he'll take a methodical approach dealing with abuse if it becomes a problem in the future. He thinks abuse and the discipline that follows should be judged on a case-by-case basis. In your personal opinion, as a veteran, should employees who abuse or disrespect a veteran, should they continue treating and caring for veterans?
Well, again, we're trying to talk in general terms, but you as well as I know that there's always 2, 3, or 4 sides to every story. And that's part of why I said before getting into anything specifically, and I would always want to know what exactly transpired, how did it transpire, and make sure we're making fact-based decisions. But the bottom line is patients should never be abused.
Thankfully, no patient suffered abuse at Mountain Home in 2016, according to administrators.
Nate's here now. Congressman Phil Rowe previously told you your findings are exactly why there really does need to be some accountability reform in the VA system. Where does that stand?
Well, the legislation in question never made it through the Senate last year. And now that there's a new Congress, lawmakers have to start from scratch on this whole issue. Representative Rowe, the new chairman of the House Veterans Affairs Committee, is considering drafting new legislation that he says would, quote, hold bad actors at the VA accountable while ensuring veterans have access to the services they have earned, end quote. The new director told us he welcomes accountability reform, saying he trusts the country's leadership to make the best decisions for the VA moving forward.
Nate Morabito. Nate, thanks so much.